Hey everybody, Ian here. Welcome back to White Pine Living, and welcome to what we would normally call a small business spotlight, but this is a little bit special today because this is more of a government agency, but it's something that probably a lot of you didn't even know existed, and it's very, very helpful and beneficial to our community. And a friend of mine tipped me off to it, so I thought I would come over and visit and see what's going on. This is my friend Marlene. Marlene is the nurse practitioner. And what is this place? Where are we?
We are at White Pine Community Health, Public Health Nursing, and it's downtown on 11th Street. And you'll get that address later.
I'll make sure that you guys have all of the pertinent info to find it. It's actually right down by the train station, if everybody knows where that is. So the name of it sounds pretty self-explanatory, but let's talk about this a little bit. So, are the services specific to children? Are they specific to women? How does this go?
We have services for the entire family here.
Awesome.
We have children's services, vaccines, mostly well child services. So when children are getting ready to go into kindergarten, we can do their hearing screen, check for lead levels in their blood, see that they're not anemic, that their iron levels are high enough.
Awesome.
Check their eyesight, do a good screening so that they're ready to go into school.
So this would be more of a preventative examinations. This isn't where I come if I'm not feeling very well.
That's right.
Kind of thing. Okay.
That's right. We don't really do like you have a sore throat or you're really sick. We don't do that kind of diagnosis and care, but we do the preventative health care services. So for women, it would be the PABS, the annual or every 3 to 5 years cervical cancer screening. We do breast cancer screening, refer for mammograms, try to get those women that don't have good coverage with insurance or maybe no insurance. We can help them get mammograms and x-rays and follow-up care that is essentially no cost when there's need.
That's awesome. See, I'm glad I came down here. A lot of people had no idea this existed. They just kind of have been, I guess, going out of town. I don't know what they do to have these things done. So, and I think I read this is targeted mostly for people that are uninsured. Is that true? Is that the idea?
It is targeted so that all people can get health care.
Okay.
So anyone with any income can come here.
Wonderful.
There is a tier system. So if you would like to bring in your income receipts, what do they call those things?
Yeah, pay stubs, whatever,
Pay stubs,
proof of
right?
income.
And proof of income, and we go on a sliding fee scale, so that's an option if people would like it. But we have services so that everyone can get health care.
Yeah, that's awesome because it could go either way. Some people will not come in and do something because they think they can't afford it.
Right.
Some people will not come in and do something because they figure, my income's going to be too high and I won't be able to get any help.
Exactly.
So that's awesome. So a few things that you guys do. So we talked about vaccinations for the children. We've done some screenings for the women. What about men? What about family planning kind of stuff? What do we got going on for that?
Well, we can serve men, particularly over 50, if they feel like they need a prostate exam. We can do that here. Family planning for men, if they have any needs or are feeling like their reproductive system isn't working right, we can do exams and referrals for men, and sexually transmitted disease referrals or testing actually here.
Okay.
And write prescriptions for treatments for that. Women, we do also the same. If there's some problem that they're concerned with a sexually transmitted disease, we do screen for that. And we offer that for everybody who may desire that.
Adults and adolescents,
That's right. It is.
Hate for that to be the case, but it's the world we live in. So.
It is. It's the way it is, sadly. But it is. So there is a place here for even teens to come in if they feel like they need some screening or they've been exposed to something, that we can help them confidentially. So a lot of things are available.
Yeah, that's awesome. There's a pretty lengthy pamphlet that they're working on, so we don't want to get into too many details. We're going to make sure that the phone number is up so that you guys can call for more specifics. But just generally speaking, again, what we have here is preventative. We have screenings, vaccinations, and all those sorts of things. And if there's stuff that's beyond your scope, you can refer them where they need
That's
to
right.
go. Kind of a starter. If you're having some issues with bringing the family into the world, then you can come here to at least get a start on what's the problem, what might be the issues, and then you can be referred
That's
out
right.
to where
We
to get
do
that
some
going.
fertility counseling for people who want to be having children but haven't been able to conceive, and get that understanding, the basics going, and then refer on if we can't achieve a pregnancy that way.
Wonderful.
Mhm.
That's a great service. Well, I hope you guys enjoyed this and will find some use for it. It's really awesome service to the community. Thank you
Great.
for
It's
taking
been
time
great
today.
to be here. Thank you.
Awesome. We'll see you guys next time.